Hi, my name is Dr. Rami Raphael. I'm a chiropractor, and welcome to Chiro-Med podcast, the pod that's all about sharing advice and cool health facts from your favorite chiropractors and physiotherapists. Today on our show, I'm joined by Dr. Courtney Broadhurst, who will be my awesome co-host today as we talk about why we're seeing more and more people suffering from low back pain during the pandemic. Plus, we'll help you by giving you tips on how to protect your spine at work and during your activities of daily living at home. So stick around. Now, before we start, I want to introduce everyone to our special first guest, Dr. Courtney Broadhurst, who is our new chiropractor at Chiro-Med Wellness Clinic. Welcome to your first podcast, Dr. Courtney.
Thank you.
Dr. Courtney, can you tell us a bit more about your education?
Sure. First I went to the University of Guelph to do my undergraduate degree in nutritional and nutraceutical sciences, and then I went to the Canadian Memorial Chiropractic College, or CMCC, in Toronto, which you also went to. Mm-hmm. A little while before I did. Not calling you old or anything.
And how was it for you?
It was good. It was intense, a lot of classes all at once and a lot of exams, but made it through, and now I'm here.
And we also have the same clinician who taught us during our internship.
Yep, Dr. Pauline M.
Mm-hmm. Greatest guy ever, and he's super humble, super funny, and he used to give us, I think for me, it was every Tuesday, we used to have like our gathering for our rounds, and this is when we learn a lot about our patients and share our difficulties in terms of situations that are so hard to solve. So we come up with ideas together. But during this time, he used to give us pierogies, and everybody comes in and share food. These are my fond memory about him. Such a cool guy. And you messaged him.
Yes, I did, telling him that we were working together, and he was super happy to hear that we were together. So
I'm happy to hear that as well. So Courtney, Dr. Courtney, it's just a great pleasure having you in our clinic. And like I said, every year when new people join our clinic, it's a great attestation to how our team is growing bigger and bigger to cater for the needs of many people in Ottawa who are suffering from different joint and muscle pain through chiropractic and physiotherapy. So we have a lot to talk about, so we're going to move on. Dr. Courtney, as chiropractors, we're seeing more and more people nowadays suffering from low back pain during the pandemic. Do you know why is that?
People are sitting at their desks for super long periods of time, and they're not moving a lot, and their desks at home probably aren't as good of a setup as they were in their actual workplace. So some big contributions there.
Exactly, and there's people more and more like not moving around because we're obviously in the lockdown, so it goes by cycle. Sometimes the gyms are closed, sometimes they're open, so there's not enough consistency with promoting a healthier lifestyle. So more people are being more sedentary in terms of their lifestyle.
And also with the pandemic being as hard as it is, people aren't emotionally and like psychologically as, I don't want to say stable, but like as positive as maybe they were before the pandemic. So that contributes a lot to back pain and any sort of pain. People don't realize how much their emotions and their mood affects their physical pain as well.
Of course, it's just like when the first thing that we learned as students is what is health, right? So health is the optimal functional well-being during the mental, social, and physical state, right? So it's not only the physical, but it's also like the emotional part of it. So if someone obviously is not feeling the greatest because of social isolation, they're stuck home all day long, obviously they're going to have to not move around, so they feel more pain, right?
Yeah.
Perfect. Exactly. Also, the setup is not the greatest, right? Like you mentioned earlier on. So they used to work in an office, and now they're just stuck home with whatever they have.
Yeah. I've heard some bad setups from some of my patients. They tell me the things they're sitting on, and I'm like, oh no.
I know, the same like me is like And then, we're very creative, right? To promote, you don't need much to change your setup. Just like a few tune-ups, like maybe like put in a book underneath the monitor, for example. We'll talk all about that later on.
Yeah.
But as we have so many great ideas for you guys, so stick around and we will educate you about how you can improve your home setup in terms of your office without having to do much or spend a fortune on changing your setup. Before we go on into the whole advice and stuff, it's very important, I think, that people understand the anatomy of the low back. Like, what are the structures that causes pain in the low back, and what is inside the low back, to help them understand a little bit about the origin of pain because we're sitting for too long. Can you tell us a bit more about the anatomy of the low back? So what's going on in that area?
Yeah, sure. So obviously we have our spine, and in between our vertebral body, so the bones of our spine, we have discs. When we're sitting a lot, the discs, they end up having a lot of pressure put on them just because of the forces going through our spine. And the discs end up kind of shifting backwards a bit, leading to, can eventually lead to some sort of disc injury, disc herniation. Obviously, it's not like a one-time injury usually. Usually it's repetitive things over and over. So even just like sitting, we don't think that's a repetitive movement, but it is putting repetitive forces, compressive forces on our spine. So it can eventually lead to injuries. There's lots of other things going on in the spine too. We've got muscles and ligaments holding our spine together. And one of the big things that I talk to my patients about is something called creep. I don't know if that's something you talk to your patients about.
Guys, it's not the creep that the guy like on outside waiting for that's not this is creeper. I'll let Dr. Courtney explain to us a bit more. What is creep?
Yeah, so essentially the way I break it down for my patients is that the ligaments in our spine are meant to just hold and stabilize everything in one place and hold everything together. But over time, when we're sitting for such long periods of time, the ligaments and the tissues around the spine kind of get, I tell my patients, like, they get turned off. They like forget that they have a job to do. So they are not stabilizing our spine like they're supposed to be. And then when we get up and like pick things up or bend forward or do certain movements, like regular movements of everyday life that shouldn't cause us to have back pain, will then cause us to have back pain because these ligaments aren't doing their jobs in stabilizing the spine. So silly things like picking up a pair of socks might actually cause you to have an injury that shouldn't, because you've been sitting for 8 hours at your desk just doing your job. So that's a big thing I talk to my patients about, just educating them on like sitting for so long is so bad.
Exactly. And I also have another fun thing that I always educate my patients, especially those who don't understand exactly the physiology or the anatomy of how a disc works. Is everybody likes food, right? So I always compare to them like the Boston donut that you guys get from your local donut store. It has a filling inside, right? So if I have to press from the front of the filling, it actually start oozing out to the back. And then it's the same thing. Everything that's in the back are sensitive structures like nerves and joints and ligaments, and they're super sensitive and reactive to pressure. So when the disc gets out, it starts pressing on all these elements, leading to pain. Mm-hmm. Right? Is there any certain bad movement that patients should avoid?
Yeah, so like I said, like sitting for a prolonged period of time is bad. And the reason it is a bad position is because your body's in what we call a forward flex position. So like bending your body forward. So that's a bad position. And then also like bending forward like that, like excessively to pick things up is not great. And then the twisting. So like we always say like bending, twisting, lifting are like the bad movements.
The Holy Triad of how to hurt your back. So literally think about the worst position or the worst activity you could possibly do is bending forward, picking a heavy thing, and then twisting at the same time. This will kill your back.
Yeah, there's just too many forces coming from too many different directions on the spine, so It just can't help.
So an example of something that's worse is like if you're sitting and then you're tying your shoes on one side and you're twisting to tie that shoes, that can cause a bad bad injury for your low back. Excellent. I want to know, according to you, what are the top 4 pieces of advice a patient can take to prevent low back pain? Like the top 4.
Okay, so obviously we've already kind of touched on a lot of this, but staying physically active, it's super tough, I know, during the pandemic, but it's really important. Just trying to have a better work setup, especially that we're all working from home. It's pretty easy. Like a lot of people just don't know, but that's what we're here for. We're here to help you. We're here to guide you in fixing your work setup. So that's another big one. Come and see us. So that's an easy way to help you guys out. Come see us here, see the chiropractor, see the physios. We can help you feel better, and we can help you get your station set up better as well. Anything? Is that 3?
Yeah. So I think the 4th advice that I can possibly give is knowing how to do certain activities properly.
Yeah.
So like getting in and out of the car, for example, knowing how to do that properly, how to carry your backpack. So knowing how to do your activities of daily living in a proper way could be a great tip that we can give our patients. So I think the best thing we can do in that podcast is go over briefly in those 4 advices or 4 tips, and then educate our patient about some great advice on how to do each one of them. What do you think?
Sounds good.
Okay, so let's talk about how to invest in a better office ergonomics, because everybody is sitting home, they're like begging us like, okay, I'm suffering from back pain, I'm coming to see you, but the pain is coming back because my office is in a bad, horrible design.
Yeah.
So we can talk about like the breakdown of the whole office. So like we can start by the chair. So when someone is looking for a great chair, what can they look for?
So having an adjustable chair is one of the best things to do, because it does allow us to adjust all the aspects of it and make it ideal for our bodies and our desk setup. If you don't have an adjustable chair, well, actually, let's first talk about an adjustable chair, maybe how we should set it up. Would that be best? Yeah. So having it at the right height. So you don't want it to be too high or too low. So you want your arms to be able to like hang at a natural position on the armrests and not having them too high or too low. You also want your feet to be at a natural position on the ground. So you don't want that to be too high or too low, and the seat not to be too high or too low. It's all about finding the ideal position, but if it's adjustable, then you can adjust it to what you need, and we can help you figure out what it is you need.
So I think the best thing we could remember is the way you're setting up your chair needs to be in accordance to how your table is. Because I've seen people buying a fancy chair, but then it's not compatible with the level of their chair.
Yeah.
And like you said, the best way you can figure that out is that when you're sitting, your arm needs to be almost like parallel to your table.
Yes.
Right? Perfect. In terms of table, a lot of people ask me, like, is it better to do sitting in a chair or a stand-up desk? What would you recommend?
I always tell my patients it's good to mix it up. Not one position is ever perfect. So I tell them to try and, if they can, go back and forth between standing and sitting. I don't know if that's what you recommend as well, but
I think, movement is important. But I think, it depends on the patient preference. So if you guys want to stand up, no problem. You can get a stand-up desk, which is ideal because you're not putting pressure on your desk because you're standing. But also if you want to just sit, if that's the case, you need to just invest, like I said, in a chair that is leveled always with your table. Always. You don't want it like a table too high or too low in relationship to your chair.
And one thing we didn't mention about the chairs is the importance of keeping that like natural curve in the low back. So most adjustable chairs, I think, have some sort of like natural curve in the chair that helps with that. But if you don't have that, you can always easily just take a towel and roll it up and put it kind of in that natural little curvature in the low of your back, just to to help the natural curve of the spine so that you're not in that forward flexed position that we were talking about earlier that puts all those compressive loads on the spine and on the discs, pushing that jelly of the donut backwards.
And it's the same advice that you can apply even when you're driving. Because some of the old models of cars do not have the lumbar support or that nice curvature that you can find in a chair. So that's the case, like Dr. Courtney said, get a towel, roll it in a sausage shape, and then just put it behind your back, and that should do the trick. Perfect. Computers. We can't live, unfortunately, in 2021 without having computers. So what is an ideal height for a computer?
Yeah, so our monitors should be, the top of the monitor should be around the height of our eyes. A lot of people I'm seeing, for my patients anyways, their monitor is too low, especially people that are working on laptops. So I know it's challenging, but especially with a laptop, if you have another keyboard to use, then it's a little easier to modify. Like we were talking about earlier, just put your monitor or your laptop up on some books just to get it at eye level. And then if you have that keyboard that comes off your laptop, you can put that on the table in front of you instead. Or if you have a monitor, then your keyboard's not an issue.
I think, the biggest thing to remember, especially with laptop, is disintegrating the different parts of a laptop is way better than just using just that laptop for our functionality at work, right? So for example, like you said, if the monitor of the laptop needs to be at the eye level, but then you have to almost like reach forward to be typing, then you need to invest in a separate keyboard that you hook it up to a USB or a Bluetooth keyboard, and also the same thing for the mouse, just to make sure that you are not really like restricted with one setup with that laptop.
Yeah. Ends up being very straining on the body if you're typing at your eye level.
Exactly, right? And also your shoulder is going to get affected as well. And how far the monitor needs to be from your face?
I don't know what the exact distance is.
Actually, people ask me, like, how should it be, like a 1.5 meters? Or like, no, like, shouldn't be that much of complication. But I can always tell them, putting, like spreading your arms in front of you, and how far your arm is from your face is that distance needs to be away from your monitor. Yeah.
As long as you can still read the letters.
Yes. If not, then go see your eye doctor. Armrests. Is it important to have armrests?
Yeah. So I kind of mentioned that about the chair, but I've seen people who don't have armrests and then they're leaning their arms on the table. So then the table is usually like too high or too far forward or whatever. So armrests are nice because then you can just, like we said, rest them naturally at your side and just parallel to the table. So that's what the height of the armrest should be. So, yeah. Yeah,
and then also if you do not have armrest, people, this is why you have tie traps.
Yeah.
Because then if you do not support your elbow completely rested, then what is the muscle that have to uplift your entire upper arm so you're able to type? Your upper trap. And I've never seen anybody in my practice who do not have upper trap that is like literally not tight at all. And if I do find someone who don't have upper trap tightness, you know where they need to be? They need to be in the Museum of Rare Collection.
I have a couple patients that don't have upper trap tightness, and it's because they're manual workers. They don't sit at their desk all day. Every single desk worker, tight upper traps.
Oh, they're lucky. They're really lucky.
You should see the rest of their bodies, though. Not lucky.
I have very tight trap because I'm always leaning on helping people. But yeah. I'm very fortunate that I have, a lot of chiropractors and physiotherapists in the clinic looking after me. So I feel very lucky. So, so people with no tightness in your traps, I hate you. I'm just kidding. I love you guys. We talked about the mouse and keyboard, and the most important one of all of them is resting. I've seen people so dedicated at work don't even rest. Is there any time limit that they need to be on a computer, roughly? Usually I tell my patients to set an alarm every 50 minutes. That's okay. Are you okay? I keep hitting the table. Sorry, guys. No worries. Yeah, I tell my patients to set an alarm every 50 minutes and then get up for 10 minutes. So just 10 minutes every hour, essentially. But
I don't know how many of my patients listen to me because I know people will power through like 5 hours, which don't do that, please, if you're listening. But yeah, that's my recommendation.
And also, like we always want to have some glass of water so they get up and move around.
I tell them to just like take a normal break, get a glass of water, go to the bathroom, walk around your house once. It doesn't have to be like anything crazy. Just 10 minutes, just stand up.
And also one of the things that also I would recommend is treat your home routine when it comes to work as if it's the same routine that you would do when you were in your office. Meaning when you used to have your lunch break from 11 to 12, use the same routine that you do even at home. So get up with your kid outside, go for a walk for an hour, and then come back to work. Just normal.
Yeah.
The only thing that would change is just now your office setup is just at home instead of an office.
Yeah, I think it's important to keep like a very similar routine to what we were doing pre-pandemic, which is not only good for our bodies, but also for our mental health.
Of course. Then you feel like more motivated, more alert to be actually doing more productive work, right?
Yeah.
Okay, so the second advice is staying physically active. Yeah. We talked about many different things about, like we heard about how physically active is important for our health, but why is that specifically important for our disc?
For our discs?
Yeah.
Keeping our bodies moving and our backs moving is important just to get blood flow to the discs and just keep them healthy, because if they're not getting blood flow, then they're just not going to be healthy. And then they're just going to end up degenerating probably faster than they should.
Also, physically active, let's say, reduces the load on disc. So you don't have to put a lot of pressure on them. So when you get up, it loosens up a bit of that excessive load on one specific location in your disc. When you're doing different types of sports or different, just running, you're just shifting your dynamic. So you're not like putting pressure only on one specific spot of that disc. Yeah. So your disc is getting an even distribution of forces just because you're active. And then what else?
It's also good for our mental health, like
that
we
know
about.
For sure.
Yeah.
And we started packing on weight as well. I know for myself. I don't know about you. I know you're very fit yourself, but
no,
come on, too humble. I know I packed up a little bit of weight, but even just that little weight that I added on, just you can feel it in your back. Could you imagine like having like almost like 4 kilogram or like 5 kilogram excess weight in the front? How much weight would that add to your back? You're about to tell me something funny.
No, I don't know anything in kilograms. I go by pounds. Am I American?
I'm used to the kilogram system. When it comes to like pound, it took me a while to understand the pound system. But I wanted to advise you guys. So every time you add in more weight from the front, it's literally the same thing, like as if you are carrying a heavy chair. Yeah. And you're carrying the heavy chair in front of you. You want to cook something, the chair is strapped on your front. You want to go to the washroom, strap on your front. You want to play with your kids, strap on your front. Can you imagine doing that for like 10 years with that weight? It's hard on your body.
Yeah, hard on our body, hard on our backs. So if you can lose the weight, go for it. Be active.
Be active. And you don't have to exercise. A lot of people confuse, like, do you have to go to the gym? No, just have to go for a walk. Walk and then monitor your diet. And then it's all about your calorie intake and your calorie outtake. If your calorie outtake is higher than your calorie intake, then you start burning things.
Yeah.
Right? But if your calorie intake is way higher than your calorie outtake, you're going to start gaining more weight. Just it's a balance, right? Excellent. Okay, so we want to learn more about tips on how to improve common scenarios of our activities of daily living that could, if done in a non-proper way, trigger a lot of low back pain. So can you give us some tips on how, for example, to lift a heavy beer case, for example?
Beer. Okay.
And people are becoming more in need of alcohol, especially in
oh yeah, it's a good example.
So what's a good way of lifting a case, for example?
Yeah, so we've always heard like lift with your knees, not with your back, which it's kind of like an old school mentality, but it is still applicable. Like we need to bend our knees in order to get down to the level of wherever the beer case is. The next important thing is just not to bend forward with your spine. So keeping that neutral spine that we talk about while doing the lifting. So instead of doing the whole hunched over straight leg bend over, you're going to bend your knees, keep a neutral spine, and then pick it up all at once.
Mm-hmm. And it's if you guys don't know what a neutral spine is, just to recap, is when you are standing, you have that nice, beautiful curvature that's like a reverse C shape for the low back. You gotta maintain that when you are lifting anything heavy.
Yeah.
And the minute you start losing this, then your back becomes more flat, and this is where the disc start loading more at the front and then start oozing out to the back, right? But what if you have something light? It looks ridiculous if you're just bending down using that method to pick up a Kleenex.
Yeah.
So what is another one you can do?
I mean, I recommend doing that one. You don't look silly, but no. You can also do like the golfer's pickup, I guess. I think everybody knows what that is. On one leg, keeping everything straight from your back to your other leg and bending over. It's kind of hard to describe, but I think people know what it is. Golfer's pickup.
I feel like it's like the stork stance when they stand on one leg and then like just bending down to pick up the food.
Yeah.
I think that's how it looks. And you gotta remember to keep the other leg that you're not putting on the floor super straight, because by doing so, as you're going down, is that you're maintaining that curvature at all time. And then you don't look ridiculous picking up a Kleenex, just bring it to the chest and then lift it up. Like it's too much. It's too much. So,
I think the biggest thing too for people is like, a lot of people know how to lift properly. It's just like applying it. Because like we're so used to lifting poorly because when we don't have back pain, we just lift however, right? But you just have to think like, okay, I need to pick something up, whether it be light, whether it be heavy, and I just need to properly do it every single time so that we don't end up injuring ourselves in the end, right?
What's the most common injury that I've been treating this winter is snow shoveling. And why is that? Because people don't even check the weather before they go to work the next day. So check your weather before. So if you know a snowstorm coming in, you gotta wake up early a little bit just to shovel the snow and take your time. Because if you don't do that, and you start Dr. Courtney, like you said, they're gonna start doing whatever, and you and your whatever is just gonna take one little wrong movements, and then it unleashes a whole sequelae of like low back pain, and then you end up landing in our office begging us to help us. Help me! I need to go to work. Help me! We're like, yes, but then you didn't lift the snow properly. So it's very important to do an extra work while you're doing your active daily living, so you don't end up paying the price later, right? Getting in and out of the car. So is there any specific way to do that, especially if you are suffering from low back pain? What is the best way to get in and out of the car?
The best way to get in and out of a car is not the way anybody does it, I don't think. But you basically want to go bum first instead of, I feel like everybody goes feet first. So you want to go in backwards. So you stick your bum out backwards into the seat of the car, sit down, and then pivot everything into your car. By everything, I mean your legs and feet.
So like in one unit.
Yeah, in one unit. So what most people do is they kind of like scooch in through the side. So don't do that. Just sit down like a chair and then turn everything so that you're facing forward.
Because like you said earlier on in the beginning of the podcast, twisting is one of the bad mechanisms that can damage a disc, right? So avoid twisting. So like Dr. Courtney said, go bum first and then just twist your whole body like in one unit rather than just like a dish rag, and then face the steering wheel in one unit. Sleeping position, what's the best way for that?
Yeah, so
I think sleeping on your stomach is the best way.
No.
Okay, so what's the best sleeping position?
I like to accept back sleepers and side sleepers as long as it's like a good setup. So for people that like sleeping on their back, it's important to put like a pillow underneath your knees if you're feeling any tension in your low back when you're sleeping on your back. And then also make sure that the pillow height is so that your neck isn't cranked forward or cranked backwards. And then side sleepers, also put a pillow between the knees to take a bit of the pressure off the low back. And then just make sure that your pillow is kind of taking up the space between where your shoulder lays on the bed and then where your head is, so that your head isn't tilted either to the left or right when you're laying down. Mm-hmm. No belly sleeping though, please. It's just bad for the whole body.
And it's like people always tell me, but I cannot sleep except on my stomach. But like, make an effort. Make an effort.
I used to sleep on my belly. I don't know what happened. Maybe I went to chiropractic school.
And maybe that's why you're a chiropractor? Because you need that?
Yeah, maybe. I don't know.
Oh my God. Okay. Finally, backpacks and purses. Mm-hmm. I know you.
You love my purse.
She's laughing because she knows. She knows. If you haven't seen Dr. Courtney's purse, it's gigantic.
It's my clinic bag. It has like books.
It has everything.
And laptops. Although, did you see what I brought today?
What did you bring?
It's
backpack.
a backpack, and I had 2 straps. I know.
It's a miracle at Chiro-Med Wellness Clinic.
I'm just listening to my chiropractor, Dr. Remy.
Her backpack before her purse was so used, you literally could find anything in it. Like, you want a hamburger, she'd give you a hamburger.
I did call it my like clown bag, just a bag full of tricks.
You want a hammer and nails, she got it. You want a bucket of paint, she has that.
Come see me.
So what is the best way to wear backpacks and purses?
Yeah, so for backpacks, wear both straps. Don't be the cool kid wearing it one shoulder. Both straps, and just high enough so that it's not hanging super low and putting pressure on your back. And then purses, if you can cross it over your body so that it's not hanging off one shoulder and pulling you to one side, that would be ideal. Same with like guys' laptop bags or whatever those are called, merces, man purses.
Man purse. I was waiting for you to say that. It is a thing apparently. By the way, I know it sounds ridiculous aesthetically when we're asking our female patients to be putting a purse across their chest, but if you ever have to bring in a purse, I would recommend not to put it on the shoulder, but rather just like carry it in your hand. Mm-hmm. It's much better than just like hiking that shoulder way up, right? Mm-hmm. Okay. We're almost to the end of our podcast. The final advice, the fourth one, is recommending to have preventative care by visiting a chiropractor and or a physiotherapist. Huh. Right?
Yes.
It's very important.
My voice got squeaky.
And that's because we are chiropractors. I speak for myself because I'm a chiropractor. It's because we are an expert in manual care just for these woes, muscle and joint pain. Mm-hmm. And you don't have to use any surgery, any injections, any medication. And we will help you get in and out of the clinic, making you feel better, getting back to your normal life as soon as possible. Because it's hard for me to visualize a life without a chiropractor.
Yeah.
Because I go along, some people never been to a chiropractor before, like, how are you guys living? How?
It's true.
Right?
Yeah.
And the same thing, I speak also from my colleague, the physiotherapist, Gate and Omnia, like they're here to also help you understand how you can strengthen your leg, for example, so you can be able to pick up like a heavy beer case, for example. Or if you are a senior patient and all you want to do is lift your grandkid without having to suffer from low back pain. So they're here to help you strengthen different areas in your body, your core, your legs, your buttocks, just your balance as well. So we're all here to help you. So one of the greatest tips that you can do during the pandemic, we're still open, we're always accepting people, is come in and see your chiropractor and physiotherapist on a regular basis, and we'll make sure you are feeling your greatest possible.
Yeah.
Right? How did we do?
How did we do?
Yeah, I think it's not bad for the first podcast.
I mean, Definitely improvements are going to be needed, but I think it wasn't bad. I don't know.
It wasn't bad. So hopefully when I'm sending this to the sound engineer, he won't kill me.
Yes, I hope so too.
Me too. So yeah, guys, thanks for listening to Chiro-Med podcast. Before we go, please show some love for our favorite guest that we have, Dr. Courtney, and we're gonna have so many.
I'm the favorite of all the guests that are gonna be.
All of you guys are favorite, to be honest. But I want to just make sure that our guests feel always welcomed. You know, it's nice to feel appreciated sometimes, right? So send us some beautiful comments, even constructive criticism in the future. You always accept it with open heart, and also please share it with your friends and family as well. So that would mean a lot for us. And until then, stay tuned for our next month's episode, because we want to be talking about chiropractic adjustments and the science behind it, and where do these cracking sounds come from? Are they harmful? Are they not harmful? So we're going to go into details about helping you guys understand what is a chiropractic adjustment and why does it feel so good after receiving such treatments. Until then, take care of yourself and be safe during the pandemic. Have a wonderful day. Bye-bye.
Bye.